While the coronavirus pandemic starts to feel like a closed chapter, there are still some among us who can't yet get back to life as normal. The too young to be vaccinated and the immunocompromised, and put pregnant people in that group as well. As new data continues to emerge about the risks associated with COVID infections in pregnancy, here's 3 News anchor Sarah Schuckman with what to know and how you can best protect yourself.
We started trying to get pregnant 6 years ago.
Caitlin Gerber's journey to be Elliot's mom has been a long one. While it all ends well, there were many chapters where it didn't look that way. She battled endometriosis, surgery, then IVF, all during a high-stress time for healthcare.
I was nervous about COVID, but honestly, I had COVID in December of 2020. I was very sick, and you don't want to think that lightning is going to strike twice.
A teacher, she was fully vaccinated, then boosted during her pregnancy.
In December, when Omicron hit, I think just everybody was getting sick, and it was just a matter of time before I ended up with it from school.
Gerber was 36 weeks pregnant when she tested positive. What started off as congestion left Caitlin feeling really run down. Within a few days, things had escalated.
By Tuesday, I really wasn't feeling well still, and something in me told me to take my blood pressure before bed, and it was sky high. So I called triage, and they told me to come in immediately to be induced. When I was admitted, my blood pressure was 160/105.
She developed preeclampsia, a hypertensive emergency.
From there, it was kind of a blur, but it was also a nightmare.
More than 2 intense days later, her daughter was born by C-section.
It was scary knowing that I was COVID positive and then about to have a baby. I was afraid that I was gonna give it to her.
But Elliot never tested positive, and Caitlin thanks her vaccine for that.
She's been very healthy. She's great. She's thriving.
She does, however, suspect that contracting COVID led to those scary complications.
They test your placenta after birth, and there were definitely some funky things going on that they noticed.
The risk is still there. Pregnant women have a higher risk than the average person on the street. And I think we can't leave behind people who are still at tremendous risk from COVID. Those people we still have to protect.
Dr. Ellie Ragsdale at University Hospitals has studied COVID placentitis, sometimes the only symptom a pregnant person who tests positive for COVID might have.
We're seeing very small babies. We're seeing babies that have blood clots all throughout their placenta, where their placenta is not providing enough adequate nutrition and oxygen to them. And we're seeing pregnancy losses that can't be explained by anything else other than COVID.
While they've seen vaccinated moms hospitalized, preterm births, long hospital stays, and fetal losses have been exclusive to unvaccinated women.
What I say to moms who are unvaccinated and are still uncertain, I am so glad for you that this has not happened to you yet, that it hasn't touched your life personally. But that's not a guarantee. And as we open up more and people do more things, we still have more and more risks of doing that.
New research has also shown coronavirus antibodies in babies with vaccinated moms appear at much higher levels than those who experienced COVID during pregnancy.
The data is pretty substantial and pretty striking.
Jessie Behringer was vaccinated before getting pregnant with her 3rd son and boosted during her pregnancy. A lawyer, she still caught COVID, likely at the office.
My cold symptoms lasted for probably 2 to 3 days. I think I probably had a fever for 1 day, and then I was just fatigued for probably a week.
Though her symptoms weren't severe, Jessie says it was a nerve-wracking experience, and she chose to be induced at 39 weeks.
I was just like, we don't know what happened. I'd rather just deliver and kind of end the worrying.
Baby Brooks was born perfectly healthy.
He was born on February 2nd, 2022, so he's got the cool 2/2/22 birthday.
Both Jessie and Caitlin want their experiences to speak directly to pregnant people who still have the option. Get the shot.
You should absolutely get the vaccine to protect you and your baby during this time. I don't think there's any question about it.
I just want to spread awareness to pregnant women that it's very important that you stay safe, because I don't want anyone else to have this experience that I had while I was in the hospital, and even after. It was a tough recovery.
Sarah Schuckman, 3 News.
Such an important story there. Well, there are a few good practices to ensure even more safety. Even after vaccination, doctors are recommending pregnant patients stay in touch with them after testing positive. They frequently suggest moms in later trimesters monitor the baby's movement for signs of placenta problems. Also, that they stay hydrated and come into labor and delivery if there's shortness of breath or any other concerns.